Can a life-saving medication become a life-threatening poison? For one man, a misunderstanding about his diabetes treatment turned his routine medication into a silent killer. Today, we explore the case of a 51-year-old man who overdosed on Metformin, a common diabetes medication. His decision to take more than prescribed led to severe lactic acidosis, acute kidney failure, and a battle for survival. The patient, weighing 77 kilograms, was prescribed Metformin to manage his type 2 diabetes. In a moment of confusion and frustration with his illness, he intentionally ingested 14 1,000 milligram tablets of metformin hydrochloride over the course of 24 hours. By the time he arrived at the hospital, the damage was already done. The overdose triggered nausea, vomiting, abdominal pain, and confusion. His family found him disoriented at home and rushed him to the emergency department. Little did they know, his kidneys were failing, and his body was descending into a life-threatening metabolic crisis. Upon arrival, the patient's vital signs revealed critical abnormalities. His blood pressure was fluctuating, his respiratory rate had spiked to 40 breaths per minute, and his core body temperature had dropped to 32.4 degrees Celsius. He was confused, unable to provide a coherent history, and his family reported a decline in his mental state over the previous day. Initial blood tests revealed severe metabolic acidosis with a pH of 6.2 and a dangerously elevated lactate level of 20 millimoles per liter. His kidneys were not producing urine, and his creatinine level was critically high at 3.89 milligrams per deciliter. The toxic effects of metformin were unmistakable. The patient was started on aggressive intravenous hydration with lactated Ringer's solution, along with a continuous bicarbonate infusion to correct the acidosis. Despite these efforts, his condition did not improve, and his lactate levels remained alarmingly high. Hemodialysis was initiated to rapidly remove the excess metformin from his bloodstream and normalize his acid-base balance. Over multiple sessions, his lactate levels gradually decreased and his blood pH returned to a safer level. The patient was discharged from the hospital after 5 days of intensive care and repeated dialysis sessions. Although his metabolic acidosis was resolved, his kidney function remained critically impaired. He requires ongoing hemodialysis and close monitoring by a nephrologist to determine whether his kidney function will recover or if he will develop end-stage renal disease. If this story resonated with you, please like, share, and comment your thoughts below. Have you or someone you know ever faced a medical emergency involving medications? Subscribe to our channel for more real-life medical mysteries and lessons in toxicology. Let us learn and prevent such crises together.